viewing us from all over the world. Give your comments on whatever platform you're using. We also do have Facebook, YouTube, and also you can put your comments in Zoom. We will be following up those comments here, also even after this panel discussion. Dr. Gabori, Mara has mentioned so many unknowns, really. As government, the scientists can say things, but you make the decisions eventually. You are the ones keeping us in masks. The epidemic is convincingly going down. Why have you not unmasked us?
Yeah, thank you, Titus. As Mara and the previous speakers have really said, there are just too many unknowns about the COVID-19. So I think obviously the government has the responsibility to protect the people, not to take risks with their lives. So that's the paramount guide. Having said that, as I said, there are a lot of main unknowns. Chief among them is, yes, we talk about herd immunity of 60% to 70%, but we don't know that protection, how long it lasts. And even when you suffer and there is an infection, how severe that second disease will come. So we can't really bank, like, we can't put all our eggs in this basket of herd immunity. And of course, we are seeing the second waves that are happening in Europe and other parts of the world, in the US, which are quite, I would say they are worse than before. So I think even looking at that, wouldn't really want to take a risk and risk a second wave. So I guess keeping this, I would call them simple, but I know if it's something that becomes your other nature, when you're not used to it, it's not as simple. Yeah, I keep putting on masks like here. You can't even smile. I can't see you smiling. You know, these are natural.
It looks like Kumbo is smiling.
Yeah, you see, so these are natural things. We're used to handshakes. Yeah, so to keep even physically apart, it's all these are impacting on our social lives. But I guess it's the price we have to pay. It's something that we need to learn and try to live until we have an effective vaccine or effective treatment that will give us that, then we'll have real hope for effective control. But as for now, I think it's better we maintain the measures that are there. Not exactly a lockdown, but these measures at least. Thank you, Titus.
Thank you, Dr. Gabori. Kumbo. Well, Dr. Gabori wants us to remain in masks. There's convincing science behind it that's really telling us not to do anything careless, and the government wants to be on the side of caution. But be honest with me, in the past couple of days or couple of weeks, haven't you come to a point of feeling like, let me not have my mask on, let me just live freely? Have you come to that kind of point of not following the measures, and why, and what's keeping you back and forth?
Well, I have actually. I've had several sleep-ups. I'm not aware of any person who hasn't had any sleep-ups. I think it's just human nature generally. You know, you can't keep up with this kind of restrictions. Keep your compliance rate at 100%. I think you'll be lying. So I found myself in this other day. There was we did hang out with friends, and we just threw all the COVID-19 precautions to the wind, unfortunately for us. So the next morning you wake up, you're kicking yourself, you're regretting, I exposed myself and my family to COVID-19, and then you observe yourself for a few days. There is nothing happening, so you convince yourself that, okay, I've survived that. But it's really difficult doing this whole compliance business.
Is that something that can make it easier? You see, it's about being cautious. Is this information that's coming out of this strong panel helpful? Does it cement your...
No, I mean, the science is undeniable. I'm not a science denier myself. It's just that these interventions are running against, centuries of how we have lived. This
maybe we can help other countries as well.
Thank you, Titus. I'll start by echoing what Silani and Gam have said, that the virus is quite new. And while there's still a lot of things that we're not sure of and we don't know, scientists and researchers are busy trying to understand just how the virus works and how we are responding to the virus. And like you've rightly said, that Africa and Malawi in general have seen a relatively low number of cases and deaths compared to Europe, America, and Asia. And there are a number of explanations as to why this is the case, but the most popular being that in Africa and in Malawi, we have a high disease burden, tuberculosis, malaria, and we're exposed to various pathogens, including some coronaviruses. And maybe exposure to these other viruses has trained our immune system and built our body's defenses. And maybe that's why we are being protected. However, there's still a few other explanations, such as people have thought maybe the environment that we live in and that the temperatures are quite warm here. And that is still being looked into as to why Africa has not experienced a lot of cases as to what was initially predicted. So because of that, and being unsure of the protection, we still need to continue being cautious. And additionally, these restrictions that have been put in, such as hand washing, physical distancing, when you really look at them, they're not just protecting us from COVID-19, but also work to protect us from certain diseases, diarrheal diseases, tuberculosis. These are diseases that are spread by close contact and unhygienic practices. So we should not look at these measures as just protecting us from COVID and that's it, but we're also trying to change our lives and become more hygienic and protect ourselves from the other diseases that are very prevalent in our society.
Look on the bright side. Thanks, Mara. So our viewers from wherever you're viewing us, whether Zodiac Broadcasting Station, whether I have online, whether you're on Facebook, YouTube, or wherever you're viewing us, remember to give us feedback, ask questions, give comments using whatever platform you're using, but also feel free to send an SMS or WhatsApp using this number. I'll say it slowly so you can have it. 0995 673 505. I'll say it again. 0995 6735 505. And at this point, let me thank all our sponsors for continuing sponsoring the Research Dissemination Conference. But in a special way, I would like to thank iHub Online for also broadcasting this seminar for free on all their platforms. Let me now turn to Gamma. What is there exactly to fear? From what I'm hearing here, it's a lot of unknowns, yes. But what I heard is that with time, viruses lose their power and they become weaker. And is there really a second wave? When should we fear it if it's there? I mean, the second wave.
Okay, I think that's a really good question. Let me tackle a couple of things here. Firstly, let me just agree wholeheartedly. Mara struck a very, very powerful and important point here about these hygiene practices that we should try as much not to be tempted to think of these as only about COVID. But anyway, let's look at COVID. The question is there going to be a second wave? I think what's clear is that the virus, this infection is just a few hundred days old, just over 200 or so days old, and there are still many, many unknowns. And so we cannot provide an exact answer to say, is there going to be a second wave or not? But what we're seeing is that in other places, there is a second wave, and a really bad one, a massive one as well. And so until we know exactly what the reasons are why the epidemic appears to be a little different here, then we cannot in any way rule out a second wave, and that it might be, completely devastating as well. But let me make another really important point here. I'm old enough to have lived through several epidemics. All right. Maybe this one is a bit dramatic, but as somebody who's studying viruses, as somebody who enjoys looking at history as well, in my lifetime alone, and in the lifetime of many of us here, let's just think about it. HIV, we've seen pandemic influenza, we've seen Ebola, we've seen SARS and MERS, we've seen yellow fever, we've seen Zika, we've seen all of these viruses emerge and really shake up the world. And so I think we really need to take something very seriously here. The fact is that this is a normal part of our environment. As we continue to degrade our environment, to expose things, to cut down rainforests, to do all sorts of things, we will see the emergence of other viruses. I mean, this is what I sit and lecture to my students in class, that look, guys, there will be a virus X. And for many, COVID appears to be similar to what the virus X is. But the one thing that I know, the one thing that I can guarantee you is that there will be another zoonotic event. There will be another virus that will enter the human population, that will shake everybody up, and that will cause all sorts of disruptions. So when we look at these measures, let's look at them in two ways. One is that these measures will protect us. There are other benefits. Those who have allergies, those who struggle with dust, those who are dealing with pollution in Asia, there are respiratory viruses that pop up all the time. These measures like masks and social distancing and other things have been really powerful, and they've done a lot. Okay, that's the first thing. But the other thing is that, if we are able to be a society that can adapt, that can take up these measures, then these viruses that are coming, and trust me, they're coming. I don't know if it's next year. I don't know if it's in 5 years from now, but the history shows us clearly that there are going to be lots of other infections, and they may be respiratory in nature, they may be quite different, but there are other viruses coming. And so when we look at this, let's try and understand as human beings that there are things that happen. There are viruses, there are other things that come into the population that absolutely change the way that we have to live. And I gave the examples of HIV, changed a lot of our sexual practices. I gave the example of malaria, which we have to live with, and a lot of us sleep in bed nets now and things like that. It's the factor of living that there will be infections and there will be these things. And so, our resistance might be a bit misplaced. Obviously, we want to relax and do what we can and have a good time and enjoy life. But let's look at the longer picture here and try to understand that this is something that's going to continue to happen. Right.
No, thanks, Gama. Matthew, it looks like we have to be worried here about COVID-19 after all. There's a lot of question because there's so many unknowns, and it looks like the future is not easily predictable. And the second wave is possible, so and it may be different from what we've experienced so far. Are we prepared for a second wave? Well, what should Malawians do? What is the government doing about it?
Thank you, Titus. I think as before, my message is largely the same. As we are learning more and more, I think new information will be coming in. But for now, the measures, the prevention measures are still the same. As my colleagues have already said, masks, physical distancing, and hand washing, and of course avoiding overcrowding, which are still those measures being at play. But as government, yes, we are looking at it at a global level. We have heard about the vaccines and everything else. So we are keeping track of those developments, and we are an active player in terms of how we participate and making sure that we also get our own cake on the table when that arrives. We have World Health Organization and all the partners of goodwill that are on our side and on the side of everyone. This is a global issue, and nobody really wants any population to suffer the consequences of COVID-19. So once I think all these things come around, become available, then we'll also benefit. But as for now, they requested the same home allowance, and we know that we can adhere. Let's encourage each other to maintain these relatively simple measures, because I mean they are quite simpler than to have a lockdown. We wouldn't want to have a lockdown and destroy the economy. I think that's the last option, but it is always an option. So I think it depends on us.
Simple measures.
Yeah, it's better we maintain the simple, relatively simple measures, so that we don't get a situation that is worse and enforce the authority in an attempt to protect the lives of Malawians into locking down. I think we don't really want to get there, but it's always an option. We are seeing what is happening in Ethiopia. They are pulling and struggling whether they should lock down or they shouldn't. It's not a good option. To close schools is not a good option. The kids will suffer, and yet possibly the kids from the disease itself, they suffer less clinically. But if we close schools, then they are paying a huge price. So I think we should all play a role and make sure that we are adhering to these simple measures while the epidemic is low at the moment, so that it doesn't spike again. I think it is to help us.
You heard Dr. Kaboli there. So we should observe the simple measures now, so that we avoid the risk of using stronger measures. Speaking from the government side, Kumbo, how does that come across? You've listened to the science, you've listened to the strong arm that the government is putting to protect her people. What do you see as the next step for yourself and maybe the people out there like you and me who are just hearing what these gentlemen are saying and ladies are saying?
Yeah, I mean, for me, I'll try to really speak as a voice from the street. I think you policymakers and scientists have to contend with the fact that at some point there's going to be, what others are calling pandemic fatigue, and that people are just going to sleep up, or going to let their guard down. And the question then becomes, how exactly can you protect populations that are willing to play a part in protecting themselves? The other thing is, I think we also need to think long and hard about the damage that these measures are going to have on the economy and consequently the livelihoods of people. We've seen these debates and the social upheavals that brought elsewhere. In America, there's a whole movement of folks that are, violent and protesting, even saying, we don't feel like that there is any need for us to be observing these things anymore. And of course, as a lay person to this field of scientists, I look at other countries that have handled this differently. So you have, for instance, I think the most notorious is Sweden. To say, there's the Swedish example, for instance, offer an alternative way to managing a pandemic of this nature. Closer to home, of Tanzania, maybe you would say Tanzania, it's a bit irresponsible what is happening, but at least Sweden, there is an acknowledgement that they do have a challenge, but they have eschewed most of the interventions that mainland Europe has decided to adopt. Right. So I think food for thought for policymakers. You can't keep people home forever. You can't tell them to mask up forever. You can't tell them to sanitize forever. At some point, we'll have to design interventions that make practical sense and are fit for purpose.
Yeah. Scientists in the house, Gamma and Mara, starting with Gamma. You heard it. Interventions that are fit and easier, I guess, for Kumbo and all to use. And also, he commented a little bit about Sweden and Tanzania. People are asking questions also on the streets. Tanzania stopped everything and they're okay. What's your comment there?
So, yeah, indeed. I mean, there's a whole science, and I think Titus, very well, there's a whole science behind, public health measures and getting people to move together. And I think for me, certainly, this is one of the most important things that we need to take from this. We need to draw the lessons and think through all the scenarios and try the different approaches. I have to be honest with you, I do think that in Tanzania, I think it's just been a huge stroke of luck. You know, I'm one of those who believes that the approach was irresponsible, and I think just ethically, I think you know that what we tend to do in these situations is we err on the side. The term that's popularly thrown out is that out of an abundance of caution. You know, you want to be safe, and you better safe than sorry. I think, you know, when we look at the statistics and we see the figures, it's easy to dismiss them because the figures and the stats are so low. I think it hits you somewhat very different when it is a personal story, when it affects you directly or relates directly to somebody, when it affects you in a very personal way. And I think that's perhaps one of the most important things that we can try to pick up on moving forward, that when we're trying to sell or we're trying to encourage people to take up these public health measures and things like that, we should try and bring it to sell it or send the message in such a way that it's much more relatable. It's a much more deeply personal story. Yeah, I think you know, we're learning a lot, and yeah. I'm very excited that there are incredible researchers, you know, the likes of Mara and others, who are trying to answer these questions to figure out exactly what's going on.
Looks like it's your time to comment now. Mara, do you have any comment on those?
Yes, I agree with Gama. Yes, we've seen that certain countries like Tanzania didn't have any measures, but haven't been affected by the virus. But as a scientist, I like working with facts. So if they say they haven't had this as many cases, what has protected them? So I think we still need to err on the side of caution and just be cautious. Where, as Gama said, we're better safe than sorry. And the government has a responsibility to protect its citizens until we have an idea of how the virus works, which we already, we know some things, but we do not know everything. So we just need to know how are we protected from the virus. Then we can make informed decisions, because public health experts like to make decisions when they have evidence and they have facts. So that just means, as scientists, we're still running around and trying to answer all these questions.
So my brother Kumbo, it looks like scientists are working. You want portable measures for protecting yourself. Yes, scientists are working. People are looking for a vaccine. People are looking for treatment. And those will be much more portable than what we're doing now. But until then, it looks like we have to be in a mask. Zilani, it looks like your job is still long from over. Do you have any last words as we conclude this session? Yep.
Yes, I think all of us who are working in this sector in various ways still have quite a way to go supporting protection for this nation. Yes, my colleagues have said numbers seem low, and the way the virus behaves and the way it has manifested in African countries is different. I don't think Tanzania is a reliable example. As Mara said, we need the facts and we need to understand what happened there, what is happening there. A country, for example, that is one of the countries we would model around the use of the protection of masks is Czechoslovakia. They were early, they masked up the entire country, and they saw very few cases, like a handful. And as the months progressed and they were a big success story in Europe, they took off the masks and now they're hit badly in the second wave. So we need to look at countries that have been affected ahead of us in the pandemic, learn from them. We need to look in traditionally and so forth, 1900s, to learn from that. So we need to continue consistent messaging around the three W's as a package together, accepting we don't know how the virus works. Medical personnel can't accurately predict how the disease behaves, whether it's race. Just do our best to do the simple things of wearing the mask, even when it's uncomfortable, because it really does make a difference together with the other W's to protect you and other people from infection. We've seen that, it's empirical evidence, it works.
I like that point. When you're doing all this, you're protecting others as well. And the point that
Correct.
it becomes painful when it strikes close to home. And that's when you realize that, oh no, I should have. But anyway, let me hear the last words from you, Dr. Gabori, having followed from all these experts. Any last words? Should we or should we not?
Yeah, thank you, Titus. From a government perspective, I would say that one life lost when it would have been saved is a tragedy. It's one life too many. On the other hand, one life saved when it could have been lost, it's a success story. So let's keep on the fight. We can't take a risk with our own lives. We can't pay a price with our lives because we don't want to put on masks. We don't want to wash hands. We don't want to keep physical distancing. And definitely we also cannot risk our economy for a lockdown because we can't do these measures. So my advice and request to all Malawians is until we are out of the woods, that we know that we have an effective vaccine, an effective treatment that we can give to the people for now. And for now, when we still don't know a lot about the disease, let's keep on these measures because these measures, they help our hospitals to cope. If the cases are just tripling slowly, then our hospitals will cope rather than to have huge numbers of people that are in need of oxygen, in need of ICU care, then our hospitals cannot cope. While these measures, they keep control of that situation. Thank you.
Thank you. Thank you very much. Now, Gama, if you can put it all together, what would be your last words in 1 minute? What is your message to Malawians? Should they not be in masks?
Thank you so much, and thanks for the opportunity to share the stage with such a wonderful panel. My message, Zinani, Mara, Dr. Gagoli, and even Kumbo, I think brought some very useful insights and views. We are always talking about how much agency that we have and how much power we have as individuals to determine and decide our own fate and our own future. I think that's something certainly Malawians have taken on very seriously. And here is an opportunity to actually do something that is responsible, something that secures our future, also something that shows love and concern for your neighbor and your friend, to show umuntu, to show a spirit of an egalitarian spirit by taking these measures. And so my plea to Malawians is Suffolk, let's please try and continue. Let's try and push these measures. Let's look also at what the other benefits are of these measures. Remember that there's always seasonal flu. I know there's a flu going around. A lot of people are getting sick now. We know that the rains are about to come. There's always going to be risks of cholera and other things like that. I think the words that Dr. Gagoli spoke just now struck home very, very, very much to say that, look, if one unnecessary life lost that we could have prevented is an absolute disaster, it's a failure, and one life saved that we could have lost otherwise, it's a huge success. And so we actually have the power to do these things, to make a big difference in our hands by taking simple measures like wearing masks. And, honestly speaking, you can say you're fatigued, but let's be responsible. It's one life that we get. So for ourselves and for our neighbors as well, one life lost is an absolute disaster. So that's really my message. But let's also remember that we're practicing for the coming epidemics. Thank you.
It looks like you can speak forever, Gama. There is a burning question from Zodiac Online before you go, Gama.
Yes.
the science of wearing a mask, Mara, get ready for the same question. The science of wearing a mask as a source control doesn't hold in our setting. In Malawi, is there any correlation between mask use, compliance, and the rate of new infections? What else do we know about the transmission dynamics in our setup? As far as we do appreciate recommendations from elsewhere, but we do need our own deep understanding. Otherwise, I haven't seen anyone using masks correctly. That's a comment from one of the viewers on Zodiac. What's your comment? 1 minute before you hand over to Mara.
Okay, so I'm struggling to understand why there's a belief that that these findings about masks will not hold the same here. We're talking about the transmission dynamics. We're talking about how we know the virus behaves, how we know how it's transmitted, and some of these things are completely universally applicable. And the person posing the question would have to certainly convince me that that this is not applicable in our setting. So for me, I think the science is irrevocable. I think it's unequivocal. I think we absolutely know that we can and we have been saving lives simply by all these measures. And remember that it's not just masks. It's masks in conjunction with these other measures. And we're saving lives. We're preventing transmission, not just of COVID, but of other things. I mean, we're going into, there's flu that's going around now. These measures are general public health measures that will keep us protected, that will keep us safe from a whole lot of other infections. So I think I'll let Mara take the rest on for here.
I think you have made your point there, but maybe Mara can answer this one. My view, the viewer's view is that the more cautious we are of the virus, the more virus we find in our ports of entry. Is that true? The more cautious we are, the more virus we find, the more vulnerable we are.
I don't think that's true. I'm not sure if they're referring to the more we test, the more virus we find. Maybe that's what they're trying to say. But the more cautious we are, the safer we will all be. And when it comes to COVID, like Gamma has said, it's not just, masks don't just protect me. I'm protecting the next person because I could be the one with the virus. So by being cautious, I am displaying umuntu to everyone else who is around me. So just because we're cautious does not mean we're going to see a rise in cases or anything like that.
Thank you, Mara. That helps. I hope it addresses the question pretty well. Kumbo, a viewer, Wesley from Sochi, says, I feel like it's too early to start going without masks because we are not really sure whether the pandemic is over or not. We see many countries in Europe experiencing resurgence after easing some COVID-19 measures. Yes or no? Are you with him or not?
No, I'm actually with him. There was this statement that struck me while I was reading up on COVID a few weeks ago. And I think the line went like, you may have lost interest in COVID, but it has not lost its interest in you. And I think that basically sums up. Good one. I think that basically sums up where we are.
Yeah. Matthew, there's another question. It looks like this one is targeting you, Matthew, as the head of Public Health Institute. How many people have been tested in total? And how accurate are the figures?
In terms of how many people have been tested in total, about 60,000 have been tested in total. About 60,000 people have been tested in total. And of course, I should just mention that as of today, a total of 5,885 cases cumulatively have been found. And unfortunately, 183 of them have lost their lives. So as we said, maybe among them, we could have saved these lives. We don't like to tell that story. Of course, without the interventions, maybe we would have also lost more. So it's not like the interventions are not helping, they are helping. So I think the request is the same.
Yeah.
Let's mask up, let's wash our hands, let's physical distance.
Kumbo, I'll come back to you before I move on to Zleni. This particular individual you're calling on the street seems a little concerned and seems to be in disbelief of what's going on. Have you ever come to that point? Is there something you can say that would encourage him to come to your current understanding?
Well, I mean, I think Dr. Badawi did touch on that particular point. I've had friends who've gotten ill, seriously ill, they've had to be rushed to the ICU, stay there for a couple of days. I know folks very close to me who have actually, sadly died. So for me, I don't have the luxury of, being dismissive and saying that, it's you can make a value about it until it really, hits home or gets very close to where you are. So for me, I would say that let's take the science seriously. It's very difficult having to do all these things, especially the mask wearing. But if it's what is necessary to save lives and to protect ourselves as well as other people, I think we owe it to ourselves as well as society at large to compete.
Thank you so much, Kumbo. Do you
to go out with friends and have fun. I wish I was able to go into park churches, and attend services without any kind of restrictions. I wish I was able to fly and travel whatever without bothering about certificates. But the reality of the matter is, the virus is here. Whether we hate it, whether we are irritated by the disruption that it has caused, it's not going away anytime soon from the look of things. And so we have to adapt, and I think that's what has to happen. So if the wearing of masks, the washing of hands, the physical distancing, just being sensible, if that helps to save lives, I think it's something that we have to do.
Thank you very much. Zleni, do you have any comments on this?
A comment on what specifically? We lost you for a moment there, so I didn't quite hear the question.
Oh, so maybe I can ask you, I can phrase a different question for you based on the same. There is quite a bit of disbelief about COVID-19 in general and about the measures. A lot of people are quite skeptical. Have you encountered such in your line of duty and advocacy? How can you help people understand and move forward with understanding that Kumbo here has?
I'm very pleased to hear that the man from the street has come around to understanding the very serious nature of this of coronavirus and the disease that it can inflict, COVID-19, and having witnessed, as he said, experienced beloveds and people that he cares about being affected by it, being rushed to hospital and suffering in it. That is where he begun, I think, to understand its severity. And I think for Malawians, it was the same before July. It was something that hadn't yet really affected the country in a large way. People hadn't yet met people or heard about close ones who were affected by it. And until people in the communities and people they knew or knew of or public figures became affected by it, they were skeptical, and then belief grew. And I think Malawians are sensible. We care about our communities and our families, and we know that this is real. There may be some doubters who, for their own reasons, do not want to go along with everyone and be part of the effort to control this. But generally, I think as a whole, Malawians have been cautious. The messages that have been delivered by various partners, the very many community interventions, the leadership events talking about this have made Malawians realize that it is literally in our own hands. And the government has done a great job in this by not locking down this country, by saying, if we do this together, if we take responsibilities as citizens actively in this Ubuntu culture, as we say at Masks for All, when we all wear masks, I protect you and you protect me. And if we wash our hands and if we try and stay at a bit distance, we can handle this. We each have a responsibility. I think Malawi has taken that quite well. Not great all the time. And we're human beings, we slip up, admittedly, but I think everyone tries to get back on the bandwagon okay. We need to continue to be vigilant in our messaging, because at this time when it's hot and uncomfortable and the numbers seem low, we may slip. But mask fatigue will lead to issues that we don't want to see of infection. That's it.
Thanks, Zlane. Now, Mara, do you want to say your concluding words? And then I'll invite Rachel Mhango to give us a summary of what we've discussed so far. Go ahead, Mara.
Thank you, Titus. My final words to Malawians is that we have done well so far, and right now is not the time to relax on all those measures. We should continue practicing all the 3 measures, and we should know that while we're still trying to understand more about COVID-19, the population should also help us and help our healthcare workers by staying safe and keeping others safe. Let's all be cautious and let's protect each other. Let's strive to come up with what will be a new normal, where we practice wearing our masks, social distancing, washing hands, while carrying out with our normal day-to-day activities. Let's incorporate COVID measures into our daily life, and that's how we overcome the COVID-19 pandemic.
Thank you so much, Mara. Rachel, may you come forward and give us a summary of what we have discussed so far. I'll give you my seat.
Thank you very much, Titus, and thank you all the panelists for the wonderful panel discussion. What I've gathered tonight is that wearing masks is another public health intervention which scientists know that it works. However, there are a lot of unknowns whereby scientists still don't know whether being exposed to the virus can protect you from the virus itself in future or not. Scientists are still trying to understand the virus since it's new. So we need to be cautious in the way we do things. If I can quote Dr. Gama Bandawe, he said, we cannot rule out the second wave of COVID-19 because we have seen other pandemics hitting hard on the world. Regardless of how long it will take for other viruses to come, they will still come. So it is a fact of living that there will be infections, and this is something that will continue to happen. However, Matthew Skakoli emphasized that the measures still remain the same. As government, they are observing what is happening in around the world in terms of vaccine at a global level, and they will do their part when time comes. And Kumbo is still asking a question: what can be done to protect the population that are not willing to be protected? Is there any other alternative? That we are better safe than sorry. Until we have an idea of how the virus works, then we can make informed decisions based on evidence, facts on how to move forward. Masking the population reduces the risk of infection, if I can quote Zilani Gondwe. And the more cautious we are, the safer we will be, quoting Dr. Chibwana. So that's in brief. Thank you.
I wish I was a good listener as you are, Rachel. Thank you very much for that wonderful summary. And let me take this time to thank the panelists for making the time for us. And I would like also to thank all the viewers for making time to watch on Zodiac Television, iHub Online, and all other platforms that you have been watching. Keep sending the comments. Thank you and goodbye.
Yeah.